Greetings, everyone. My name is Sarah Norman. I'm the Director of Healthy Homes and Communities here at NeighborWorks America. Welcome to the second webinar in a four-part series titled, Can Housing and Community Development Really Improve Health Outcomes? We're excited you can join us today. We hope that through a series of webinars, we can address the important question and highlight promising practices to further integrate health into housing and community development. This second webinar will focus on healthy homes, which focuses on programs, activities, or built environment interventions that improve health within the home. We will be tweeting throughout the webinar using the hashtag located at the bottom, hashtag Healthy Communities, if you would like to follow the conversation on Twitter or contribute. Thanks to everybody who contributed to the poll. We now have the results if you want to see it. We asked folks what sector you were involved in, and looks like the winner was housing and community development, 77%. Second most common was public health. So thanks to everybody who let us know that. And we'll have a few more polls going, so keep tuned. Before we started the discussion today, we wanted to go briefly over the webinar logistics in case anyone experiences technical difficulties. The webinar will be recorded and posted on the NeighborWorks Health website within a week. If you are experiencing any difficulties with logging on to WebEx, we have posted the presentation slides on the NeighborWorks Health page. We will hold the question and answer session until the end of the presentations. Thank you to everyone who sent in questions in advance. Our speakers are aware of your questions and will try their best to answer them throughout the webinar. And if you do have any questions during the presentation, please type your questions in the chat box and we'll do our best to answer them. You can also email questions to snorman@nw.org. Lastly, if you experience any technical difficulties, please email me at snorman@nw.org. I moonlight as a technical difficulties assister. So again, welcome. Thanks for joining us. For those of you who are not familiar with NeighborWorks America, we're a national nonprofit organization established by Congress to help build strong, resilient communities by providing people with opportunities to live in safe, healthy, and affordable housing, whether they own or rent. Through grants, training, and technical assistance, NeighborWorks America supports the network, the efforts of NeighborWorks member organizations in the community development field to develop healthy homes and communities. We engage and serve residents across the lifespan, including infants, children, older Americans, veterans, individuals with disabilities, and many others. Before we start the presentation today, we need to first define what we mean by a healthy home. And I think most people have in their head or have a favorite definition. The one that we're showing up here is from a federal working group on healthy homes, and they focus on dry, well-ventilated, pest-free, safe, contaminant-free, clean, well-maintained, thermally controlled. Those are the things that they pull out as the priorities. According to the Center for Disease Control and Prevention, a healthy home is sited, designed, built, renovated, and maintained to support health. And a healthy homes approach is a coordinated, comprehensive, and holistic approach to preventing diseases and injuries that result from housing-related hazards and deficiencies. What's important about this is the impact this has on folks' health. There's 6 million Americans today who live with moderate to severe home health risks, whether it's respiratory issues associated with asthma or other respiratory illnesses, slips or trips, and there's a range of different issues that are identified. Another thing to consider is indoor air quality, with 38,112 lung cancer deaths associated to secondhand smoke. Those are just a few statistics that are really relevant to this. The agenda for today's presentation will start off with Gina from the Healthy Building Network, followed by Ruth Ann Norton from the Green and Healthy Homes Initiative, Carla Potts from Northeast Community Action Corporation, and Marianne Garvin from the Community Development Corporation of Long Island. Again, we're going to hold off on questions and answers until the end of all presentations. But we will try to make sure we get to most questions by the end of the presentation. First, let's start it off with a poll question. You'll see. Okay. Second, we're going to run to Gina, and Gina's going to start us off. Gina is responsible for integrating and scaling healthy materials into the affordable housing sector. Gina, welcome.
Hi, thanks for having me. I'm really excited to be part of this Healthy Homes conversation today. Again, I'm Gina Saganek. I'm a Senior Advisor for Housing Innovation with the Healthy Building Network. Healthy Building Network's mission is to advance the best environmental, human health, and social outcomes through the transformation of the building materials market. I recently took on this new role after 2 decades of developing affordable housing in Minnesota. Up until 3 months ago, I was the Vice President of Housing Development for AON. I developed and preserved thousands of affordable housing units. Under my leadership, AON became known as one of the most innovative and sustainable housing developers in the country, seeking a better model that would allow for affordable housing to be healthy, high performance, and equitable. We would often say we were innovative because we sought practical and replicable solutions so that best practices could be brought to scale. In my last affordable housing development I worked on, called The Rose, which just opened on September 5th, it was a 90-unit mixed-income apartment community in a low-wealth neighborhood in Minneapolis. The Rose has been recognized as one of the healthiest new developments in the country because of its 5,000-square-foot community garden, unique active living opportunities, supportive housing services for residents with mental health challenges, and other familiar health components. Those amenities are great, but certainly not what is most unique. I am here to introduce somewhat new elements to the health conversation. It's an issue that some are calling a silent epidemic that is affecting all of us in ways that we likely don't even realize and disproportionately affects low-income populations. Home sweet home. The affordable housing sector has come a long way from the day of massive, inhumane places like Cabrini Green and the Robert Taylor homes. We pride ourselves on creating homes, not just 4 walls and a roof, not merely a shelter from the elements, but a safe, affordable, and healthy place for families to thrive. Studies show that the new era of affordable housing positively affects residents' lives and improves the broader community. To achieve a new generation of sustainable, healthy housing, the Rose used the Living Building Challenge program as a framework. It is the most aggressive and holistic green program on the market today. It goes beyond energy and water efficiency. It also incorporates elements such as beauty, equity, health, and specifically has a requirement to install healthy building materials. By tackling this healthy materials challenge, my entire paradigm shifted when I thought of the phrase home sweet home. What our homes are made from. What I quickly learned was that building products were full of terribly toxic chemicals. I found it was difficult to obtain information from the manufacturing industry about the names of chemicals in their products and the effects on human health. And when there was transparency, it was often very complex information that only chemists and highly trained experts could really understand. With a little research, I learned that the toxics in building products have significant impacts on human health and on natural systems. It is an incredible cost burden on the healthcare system, and worse, it is eroding the quality of life for many families. So the magnitude of the chemicals. In 1976, the Toxic Substance Control Act was put into place. At the time, 60,000 chemicals were grandfathered in without any evaluation. Today, there are over 80,000 chemicals listed in that inventory. In the nearly 4 decades since first enacted, the EPA has only been able to require testing on just a little more than 200 chemicals, and only 5 chemicals have actually been regulated. Who else is affected by all this? It's true that not many of us can hide from this issue, even if you have significant wealth or you're an animal up in the Alaskan wilderness. These industrial toxins are now found inside all of us. They are known carcinogens, mutagens, they affect brain development and function, they create and trigger asthma, just to name a few. And many are persistent and bioaccumulative, building up inside of us and wildlife over time. Low-income communities are disproportionately exposed and affected. Many low-cost products are filled with toxins that end up getting inhaled and ingested through off-gassing, through dust, or through transfer into your skin through touch. Lower-income communities are often working construction jobs, handling toxic materials, and then coming home with chemicals on their clothes, impacting others in their households. Some are in the manufacturing industry. Of course, they are constantly working with products that are being made and assembled. Finally, there's factories that emit pollutants in the air and are often located within low-wealth communities. These are the fence line communities that also get affected day in and day out. I found it shocking and unacceptable to read studies from the Environmental Working Group and other researchers who found more than 200 industrial chemicals found in umbilical cord blood. Our babies are being born with toxic chemicals already in their bodies. Chemicals that are known to affect brain development, that the endocrine system, they're cancer-causing, they're cell-mutating. I was compelled to join the Healthy Building Network to raise the level of awareness, encourage the affordable housing sector to take action. I'm happy to report that a strategic partnership has been formed between the Healthy Building Network, Parsons Design School, Green Science Policy Institute, and Health Product Declaration Collaborative. These groups are creating tools and resources to support the affordable housing sector. Some examples include Healthy Building Network is organizing a series of roundtable conversations, in person and virtually, to provide education, resources, and to learn from the sector how best to support change. Our partner, Parsons Design School, has created a Healthy Materials Lab to support healthy homes for all people. Tools and resources. There are a few organizations working on improving information and access to healthy materials through transparency, identification of chemical hazards, reviewing products for healthfulness, etc. We are working to leverage these resources to help minimize complexity and increase the library of healthy, affordable products. One of the tools by Healthy Building Network is called the Pharos Project. It is the most independent and comprehensive database for identifying health hazards associated with 60,000 chemicals and thousands of building products. It encourages manufacturer transparency, helps architects, designers, and building owners avoid using toxic building products, and creates incentives for product redesign and modification that reduces impact to product life cycles. Healthy Building Network is also nearing the launch of the Avoided Hazard Index. It will allow comparisons to be made between two building materials, a typical baseline product that is often filled with toxic chemicals, and a healthier option. So I have removed the specific product names. You can see that this table is a comparison between a linoleum flooring product and a vinyl-based product. The human health hazards are listed on the left column, from persistent and bioaccumulative chemicals to carcinogens to mutagens, asthmagens, etc. This example relates to 1,000 square feet of a product, about the size of a two-bedroom apartment. As you can see, by installing the linoleum floor, you would have avoided more than 126 pounds of toxicants from the environment. So doing the math to understand how quickly this benefit adds up, let's say you have a 90-unit apartment complex. 126 pounds times 90 units equals 11,340 pounds, or roughly 5.6 tons of avoided toxic chemicals that have known human health implications. Remember, this is one product, one building. The Avoided Hazard Index is a great new tool that helps us quantify our product choices. There are case study projects. There are architects, developers, and building operators who are beginning to insist on healthy products. They are sharing their research and product libraries with us so that we can collect and widely distribute the information. The Rose is one of the first case study projects providing this information. So I'm here today to suggest a call to action for everybody. I'm fully aware that we are all inundated with a massive amount of priorities that we are being encouraged or required to incorporate into affordable housing, often with fewer and fewer resources. This new collaboration between health and housing is one of the most important I have seen in the last 2 decades. We are all working on access towards healthy food, to health care, to outdoor activity space, to support for those with mental health issues. And we're discovering some creative finding options like Pay for Success. I hope that in addition to healthy material, this is not seen as yet another burden, but instead an element of health equally as important as the others. We will be fighting an uphill battle, even if access to nutritious food is available to all, yet we are living and working in toxic environments that are causing serious human health challenges and costs. The affordable housing and health sectors have an opportunity to be leaders in this campaign, and through education and demand for healthier products, we will be able to transform the building materials industry towards a future where healthy materials are the norm and human and environmental health flourish. An easy place for everyone to start is by simply asking for information about the building product you're purchasing. Insisting on transparency and disclosure is the first step towards change. Thank you for your time.
Thank you so much. I have a question for you. If someone is interested in pursuing this work in their community, what would you recommend as the first step they take? What was the first step you took?
The first step was we brought together a really great team of partners, architects, designers, the University of Minnesota, bring together people who can help wade through the difficult information. At the time, this partnership with Healthy Building Network and some of the other partners was not available. So today, I would say to give Healthy Building Network a call, and we can help set you on a path for success without the sort of alone, independent feeling we were working through on the road.
Thank you. And now we're going to go up to our next presenter. Just a message to our presenters, if you're not presenting, please keep your phone on mute. And our next presenter is Carla Potts. Oh my gosh, I'm so sorry. It's Ruth Ann Norton. Ruth Ann Norton, I can't believe I did this to you. Both from Baltimore.
That's okay. I saw the picture, but I thought maybe I changed my name. So
you know, we're switching around bodies these days. Ruth Ann Norton serves as President and CEO of the Green and Healthy Homes Initiative. And with that, I'll give it over to you, Ruth Ann.
Well, thank you, Sarah, and welcome everyone from sunny Baltimore, Maryland. Let me tell you quickly about GHHI and our 5 key goals, and I want to thank our previous presenter who I thought was well impassioned and thoughtful and great presentation. Green and Healthy Homes Initiative, which was formerly known until 2009 as the Coalition to End Childhood Lead Poisoning, has been lifted up to help accomplish 5 key goals in the United States. One is to help build the national understanding of the positive health benefits of energy efficiency as a part of a healthy home standard. So if you go to our website, you will see actually the 8 elements of healthy housing built around energy efficiency and weatherization as well, and you can even take a quiz on healthy homes if you'd like to do that. The second is to establish and attain approval, establish the evidence and attain approval for medical payment models and reimbursement for healthy homes interventions that remediate environmental health threats via Medicaid, state Medicaid, and hopefully federal Medicaid and private insurance, helping to bring the healthcare industry as part of the funding mechanism for healthy housing. The third is to demonstrate the health education and social outcomes that we see clearly from the advancement of healthy housing in the United States. We are especially focused on school attendance and work attendance, which you'll see in some of our data. And then we are also focused on bringing $100 million in new funding to the healthy housing field over the next 3 years. And the fifth, which we'll talk about today, is finding new mechanisms to scale the field of green and healthy housing. So if we go to the next slide. We look at this in both the moral case, that it is a moral compass for us to ensure that every child and every family and every senior has the right to live in healthy housing, but it's also a strong business case that's being made. With the 9 million families that are living in unhealthy homes today, we're costing about $43 billion a year to still deal with one of America's greatest environmental health threats in lead poisoning, another $56 billion to deal with asthma, and another $20 billion for falls for seniors. This comes from this financial burden, though, represents that the 24 million homes impacted by asthma and allergens, and that's 18 million adults and 6 million seniors, and as well as the 24 million homes and the 535,000 children impacted by lead poisoning every year, and the over $90 billion that we're spending on falls, from 18,000 deaths and 12 million non-fatal injuries in falls, all of which are preventable in the United States. And if we look at asthma, for example, where every dollar invested returns up to $14 to the American taxpayer, and every dollar invested for lead poisoning returning up to $214 million, it's clear that we can act, we should act, but we also need to pay attention that kids are missing school because of asthma, and the number one reason that they miss school every day is 14 million school days are missed a year. And 40% of those asthma episodes that are impairing the ability to get to the classroom healthy and ready to learn, according to the Commission to Build a Healthier America, come from unhealthy housing. Let's go to the next slide. So I like to tell stories, and I will tell you that this is a story that I have told many times, and today we are actually officially archiving this story, so I get to tell you about one of our first families that came into our work in the Green and Healthy Homes Initiative in 2009 for the last time on the national stage here. But this is DeWayne Davis. You see him up in the upper right-hand corner. In 2009, his mother, Laquan Young, called the Green and Healthy Homes Initiative. She called us because she was concerned that she was about to lose her job because DeWayne had been in the hospital 3 times in the previous 6 months, missing over 3 weeks of school and causing her to miss weeks more from work to care for her son. It came from a house that was full of mold, lead, where the heating systems did not work well, leaky roofs, and a home that she owned and was supporting her family as a single mother, but was really burdensome in the ability to overcome the problems that were facing her. She went to one program after another that turned her down. The weatherization turned her down because she had lead paint problems. Lead paint, the program turned her down because she had mold problems. So really these systems that were there to help families were causing more problems because families needed money, couldn't get them because of the unhealthy housing conditions were preventing the grants from moving forward. If you move to the next slide. If you look at this graphic that we have, this represents what Laquan Young was facing and still tens of thousands of families face, especially in low-income neighborhoods in America today. And that is fractured systems that don't deliver in a more unified basis to a standard of healthy, safe, and energy efficiency for every philanthropic and federal dollar that is invested. One of our goals is to fix that. If you were Laquan Young on the day she called us, she was looking upward into a system that had 238 different programs and federal, state, and local programs available to her in Baltimore, but for which it would have taken her 23 days worth of missed time just to bring those programs together to solve the common problems in her home and improve DeWayne's health. So you go to the next slide. So we thought there has to be a better way. And so what we did was to create the Green and Healthy Homes Initiative, not only to work on those national objectives that we talked about at the beginning, but to also solve the problem of families having to hunt from one program to another and instead align, braid, and coordinate those funding activities and programs that were focused on housing in order to improve those social determinants of health that can improve outcomes, but also to make sure that we created a single portal of delivery that looked at housing holistically. So we have created a comprehensive assessment tool that's been adopted around the country in 25 cities and adopted by the state of Maryland for every housing program that they're looking at, and to coordinate those services together, to train weatherization contractors in lead paint and healthy housing, to train other contractors to be able to cover the gamut of green, healthy, safe, and energy-efficient housing, and to ensure that programs would work together in bringing people into a system by sharing data and by ensuring that we did not duplicate services and instead focused on an integrated process to deliver on lead hazard reduction, asthma trigger control, fall prevention, energy efficiency, and weatherization. So if you move to the next slide. So with a number of very important partners, some of these you'll see here in our larger framework nationally, Habitat for Humanity and Energy Efficiency for All, the Conference of Mayors, the Grade Level Reading Campaign, and the Building Performance Institute and Childhood Asthma Coalition. We are moving forward in this aligning, braiding, and coordinating framework to prove the evidence about healthy housing and also to ensure efficient delivery of these services on the ground in our 25 cities. If you go to the next slide. And in doing this, for thousands of families around the country through GHHI's 25 locations, we have many results that were shown here for Laquan Young and her son DeWayne. So in 2009, in 6 days, in 6 different funding programs, we brought together an ability to actually save government 25% up front by integrating these activities together. But most importantly, we've delivered a house with new flooring, new roofing, new mechanicals, removing the lead and the mold, and improving the indoor air quality issues. And since that date, DeWayne has not ever returned to the emergency room or the hospital. He's succeeding in school, and his mother has received not only did she keep her job, but she's received a promotion at work, and the family has for the first time been able to establish a 401k account and a college savings account because DeWayne now wants to move to the future of college and university exactly where he should be. So that's what we want to deliver when we have this aligned, braided, and coordinated approach for healthy housing. If you'll move to the next slide. So one of the things that we've done is to look at our program through our various grant programs and funding. And we published a study last December in the Environmental Justice Review where we looked at 240 families receiving our services. And what we found is that for 139 children who were suffering from chronic asthma, meaning they were having repeated trips to the emergency department and hospital, here's what we found. A 66% reduction in asthma-related hospitalizations. In our program in Philadelphia, we have a 76% reduction in the program between the City of Philadelphia and St. Chris Hospital. We had a 28% reduction in asthma visits in this particular study. Most of our studies have ranged closer to 40% in the reduction of emergency department visits. A 50% increase in participants not having to use urgent care. And most importantly, we had a 62% increase in children moving from chronic and frequent absences to perfect attendance in school, and an 88% increase in parents' ability to get to work because instead of being in the ER with their children, their kids were able to sleep through the night, be healthy, and get to the classroom healthy and ready to learn. So, next slide, please. So we're expanding this program almost daily through our work with mayors, county executives, and governors across the country and their nonprofit partners. We're currently in 25 cities. We welcome most recently the city of Syracuse, who received a grant from the Attorney General of the state of New York to help establish a Green and Healthy Homes Initiative program. And we have about 60 cities who've applied for designation, currently going through the application process there. GHHI as a program nationally provides technical assistance for sites to help develop partnerships, and we call them learning networks, and that establish a shared data platform, a shared referral platform. But we go deeper in the sense that going beyond just referral and education into comprehensive assessment, coordinating services to do the intervention. Each of the programs in our sites are run by what we call outcome brokers, the individual and program responsible to drive partnership to create best practices and to help us advance the goals and mission of GHHI. Next slide. So one of the things that has come out of our work has been a very clear pathway of the data collection and outcomes. And so the Green and Healthy Homes Initiative was one of 8 organizations selected by the Corporation for National Community Service to receive a grant to advance Pay for Success across the country for healthy housing, and we're very grateful for that. We're also working in 5 cities around the country through that funding, and we also had previously begun and are close to closing on a transaction here in Baltimore with the Johns Hopkins Health System using Pay for Success, paying for outcomes by the measures that we do after referral from health clinics. It's an evidence-based program, as Pay for Success programs need to be. It ensures prevention, and we've been able to demonstrate how it generates cashable savings. So let me take you through a synopsis of our transaction in Baltimore. Our funders at the Calvert Foundation and their partners have agreed to put up $10 million in upfront capital from the private sector that will flow through our intermediary, a group called Social Finance. Through that, money will flow to our direct service program in Baltimore at the Green and Healthy Homes Initiative. The GHHI program will implement the referral, assessment, intervention, and education program I described, and with targets set by an outside actuarial, a firm called Milliman, used by most healthcare institutions in the country. We aim to deliver successful interventions that will reduce ED visits and hospitalizations for children referred by the Johns Hopkins Health System through Priority Partners, their Medicaid managed care service organization. We endeavor in this program to serve 600 families a year. That work that we will be doing on the Hopkins referrals will be evaluated by the Hilltop Institute at the University of Maryland, Baltimore County. They hold the Medicaid cost records, and if we meet our success metrics, then Johns Hopkins will repay Calvert and their bondholders. And as part of this program, the Kresge Foundation and Robert Wood Johnson Foundation will be providing risk mitigation guarantee. Hopkins will also be working with the State of Maryland Medicaid Administration in advancing this program. I'm hearing a lot of feedback. I don't know if any others are. But I'm happy to answer questions about this Pay for Success program, but we believe that this is a pathway to help scale things that work. Healthy housing clearly works, energy efficiency clearly works, and so we're using this model to replicate this around the country in the 5 sites funded by CNCS, and we will be announcing 5 more in November funded by a national foundation. Next slide.
Thank you. Thank you, Ruth Ann. Oh, sorry.
That's okay. That was just our 5 sites that we can go back to later.
Phenomenal. And our next presenter is going to be Carla Potts. And so, Carla, you're up. For presenters who are not presenting, please put your microphones on mute. Thank you, Carla. You're up.
Thank you. Thank you, Sarah. Well, I'm going to talk about our Healthy Homes program and the pilot that we did with SSM Hospital, which is the Sisters of St. Mary. I'll tell you a little bit about Northeast Community Action Corporation. We're located in Bowling Green, Missouri. We're a community action agency. We're a neighbor works organization, a rural list member. We serve 12 counties in Northeast Missouri, with 9 of them being extremely rural counties and 3 being urban counties. When we began our pilot with SSM, our purpose was to give patients recently returning home from the hospital the opportunity to recover in a healthy environment. And we began our pilot with 2 community action agencies, ourselves and the Community Action Agency of St. Louis County. And we looked at improving the recovery rate of recently discharged patients through education and improved home air quality. We devised a selection criteria that the patients must fall within 200% of poverty guidelines. We did a minimum of 15 with residences in St. Louis County and 15 in St. Charles County, which is one of our counties, but we expanded that out and pulled into some more of our core counties, which are also core counties for the Sisters of St. Mary Hospital. They had to be admitted to SSM and receive Medicare or Medicaid. They had to have respiratory problems, and we've talked about those problems, COPD, pneumonia, asthma. They had to agree to support interventions and sign a release of information form. And they had to have had at least one readmission to the hospital. We debated long and hard with the hospital how to get the referrals and talked about HIPAA and all the regulations that hospitals and medical providers have. So we began by that the home health care intake coordinator would meet with the patient before they were discharged. The home health care nurse, and this is all from SSM, would make a visit to the home, and the referral would come from their home health care LPN directly to NECAC or the other community action agency. And then we would call the patient to schedule the visit. Within 7 days of the patient being discharged, our case manager was in the home. We did a complete intake and assessment of their goals and their health needs. We were really clear, though, that we didn't want to have medical information. We are not medical providers any more than hospitals are taking care of homes and improving home air quality. They're not that. We're not medical providers. We operate a weatherization program, and so that was first and foremost in our mind of how we piggybacked healthy homes and weatherization. The improvements that we did on the home, we did mechanical ventilation, we looked at air leakage control, we looked at safety of the home, we looked at minor home repair and some major home repair. We looked at the whole indoor air quality. We looked at, are there poisons, are there things sitting around? And then, of course, we looked at the heating system, if it needed to be repaired or replaced. Funding, always a difficult thing. We received some initial funding from Wells Fargo, and I might say on the very first home that we did, we had SSM come out and we did a kind of a tour and talked about the patient, the client to us, the patient to them, talked about the differences that they were seeing once the work was done, and that they were able to go back to work and hadn't been able to do that for a very long time. But we also had Wells Fargo there. We had so many Wells Fargo people, we said it's kind of like the little clown cars that they just kept coming and coming and coming. But very, very impressed with the Healthy Homes program. The Department of Energy weatherization program allowed us to do the audits, not only the weatherization audit, but the Healthy Homes audit, and they paid for that. We received funding from the Federal Home Loan Bank of Des Moines, which is our Federal Home Loan Bank. While we were doing this pilot, we were working with the state to try to get Medicaid to begin to pay for healthy homes, and our governor signed into law in July that Medicaid can now pay $300 for a Healthy Homes audit and $100 for education. We're still working with how all that billing is going to take place, but also if we can get them to start to pay for some of the indoor air quality and some of the issues that need to be done in the home. I recently met with SSM's grant manager, and SSM operates hospitals in Missouri, in Wisconsin, and in Oklahoma. I met with the grants manager, and we're working on beginning to get SSM to start to pay for this. They're certainly seeing some results out of a very small pilot, and they acknowledge they're seeing results, but it's moving that unwieldy bureaucracy of a hospital to start to pay for it. But I think we're on the track to get them to do that. We did the Healthy Homes education over a 12-month period. We looked at evaluating the home at the patient at 3, 6, 9, and 12 months. The hospital looked at, are they following their medical plan? We looked at absence of readmissions. We're a weatherization provider, so of course we looked at utility costs. And then if they needed other support resources, are they utilizing them? Were there other things going on in that home that needed to be addressed also. We didn't put a case study out, but quickly I'll tell you about a couple. We had the first lady that we did that had COPD, had not worked for over a year. We were able to go in, home was much healthier, she could breathe, she wasn't going back to the hospital, and she started a little part-time job. We had an elderly lady who had leaks in her basement, had a lot of stuff in her basement, all of it got wet, all of it molded. She had no way of getting it out because it was creating a tremendous health hazard in that home. And so my crew of Healthy Homes Weatherization guys went in, cleaned her basement out, sealed the basement, did a lot of other things in the home. And I say we always go that one step farther. She had doll molds. She made dolls. And she didn't want to not find something to do with those. So my guys took them to an auction, sold them for her, and brought her back the money. So always that one little step farther to help. But her health has improved dramatically because of that. And the last slide, of course, is my contact information. Thank you.
Thank you. And our next up is Marianne Garvin. And thanks again for speakers for making sure that you're on mute when you're not presenting. We're looking forward to hearing from you, Marianne Garvin, from the CDC of Long Island.
Thank you. Hello, everybody. I know we're running a little bit behind, so I'm going to try to go through my presentation quickly. CDC of Long Island is a NeighborWorks organization, and we have been providing housing services to Long Island for 46 years. We have a range of housing services, but the ones I will talk about today are the Weatherization Assistance Program and our Homeowner Rehab Program. We have been historically doing those programs in coordination to create healthy homes for people, and never thought of this as a healthy homes program linked to health outcomes. Just knew that it was the right thing to do for families and trying to be comprehensive in our approach to the housing stock and to the people that live in the housing. However, 3 years ago when Superstorm Sandy hit Long Island and we had severe flooding in thousands of homes, and the result of that was lots of mold growing in the homes, then it hit us in a different way, and we understood the severe health impacts of an unhealthy home. After a couple of years of implementing a mold remediation program with funding from the Robin Hood Foundation and the American Red Cross, we realized that we needed to be more intentional about looking into two things. One, the impact on health outcomes from the built environment, as well as the services that families need, low-income families need with their health service delivery. That second part came to our awareness about the same time as Superstorm Sandy hit because of changes in the adoption of the Affordable Care Act and the Medicare redesign efforts that are taking place in New York as a result of the Affordable Care Act. And one of the things that we realized is that we are a housing organization. We're housers, as are apparently 77% of the people on the call or on this webinar that are listening in. And we didn't know very much about the healthcare delivery system. And so the first thing that we did was outreach to people who were heavily involved in the healthcare delivery system, as well as people who were addressing changes to their own delivery system because of the Affordable Care Act. And what came out of that, and you can advance the, what came out of that was a convening that we put together with our partners. If you could go back to Okay, this is the second slide, sorry. We put a convening together to bring together the two sides of the industry, the healthcare industry and the housing industry. And we did that with Hofstra University. And we did it to create a learning environment for the stakeholders on Long Island who were interested in this this topic, and because we're very, very much at the beginning stages of, as an island, at looking at this. Our goal with the convening, which took place in June, was to create a white paper that would have all the research of which there is a huge amount that demonstrates the importance of healthy homes. So we don't really have to go back there and re-demonstrate that because it's out there. We had some national folks coming and talking with us. The second outcome of this convening was that we launched a pilot program ourselves to try to bring the resources together and in one particularly hard-hit community. So could you advance the slide? Thank you. So these are the funders and partners in our pilot. We have the weatherization program, and that was an asset that we have because we've been running the weatherization program on Long Island for 25, 30 years. The United Way, we are a United Way organization as well as a NeighborWorks organization, so we had funding from both of those. And Hofstra University brought their research element to the table. JP Morgan Chase Foundation provided some additional resources to us. New Health is the healthcare group that became our partner in this pilot. And the Hempstead Housing Authority is the demonstration site, if you will. So advance the next slide. This is one of the buildings that is owned by the Hempstead Housing Authority that is in disrepair. You might ask, well, the Housing Authority should have the most perfect housing. Why is it in disrepair? They had a little bit of a scandal at this Housing Authority where prior administration absconded with some funds, and so repairs that should have been made were not made. And so we are in the process of weatherizing this building as well as using funds from the foundation to make repairs. So we're doing health improvements into the building and the weatherization green initiatives as well. Go to the next slide. Here are the economic characteristics of the village of Hempstead, where the Housing Authority property is located. You can see that it's really the poorest village probably in the entire state of New York. More than a quarter of the population without health insurance, 20% below the poverty level, 13% unemployment, and unemployment on Long Island in general is at 4%. So you can see how this is a very, very poor community. 47% speak a language other than English at home, so it's a high immigrant population, and the percentage that are receiving supplemental nutrition assistance. That's why we picked the village of Hempstead. That's why we picked this particular housing authority to work with. What are we going to do there? We are going to make improvements in 30 public housing units, plus in that village, which is primarily single-family homes, we are selecting 10 owner-occupied homes. We're going to do the same kind of what we call wrap. We're going to do weatherization and rehab on those homes. But then in addition to that, and this is the part that I think is unique and that we're going to be testing out, we're doing inspections of all of the housing units to see what the health and safety needs are of the residents. We're going to collect baseline health data on 100 individuals, and we're bringing in the healthcare providers to provide services based on what those needs are. Many of the people in this development do not have health insurance. They use the emergency room for their health care needs, and we have the ability through this partnership with this major healthcare provider to get data on the population that are living in these homes and then compare that a year out after we have delivered services to see how it's been improved. So our outcomes are going to be the better health for very low-income Village of Hempstead residents. This is a pilot in that we have to demonstrate, and we're not as far ahead as Ruth Ann or some of the other folks are in this regard. Where on Long Island we are in the infancy stage of putting together and implementing programs. But our hope is that with this pilot, we will be able to create a model that we can replicate across the island, not just CDC, but others who are interested in having a better model of health and housing sectors working together. And thank you very much. That's my presentation.
Thank you so much, Marianne. And now is our section for questions, and I'm going to start with some questions that people submitted before. Ruth Ann, you shared a little bit about an SIB, and I wanted to find out, some groups asked, how would an organization sell an SIB for trip and fall prevention? Do you have any thoughts on that?
Sure, absolutely. There is such a great return on investment on the fall prevention work. It is a low cost, high return. I don't have the data right in front of me, but there's a lot of good data around cost reduction and a fairly straightforward set of interventions. So really the things that are important in looking at pay for success or social impact bonds around trip and fall or fall prevention really have to do with a couple of things that we'll talk about if there was a feasibility study. So the first thing that we would look at in the structuring of that is what is the data, systems that are collecting the data, what is the evidence-based practice, so what is the tool being used for the assessment, and what is the catchment area or referrals so that there's enough referrals that would make sense. And then the capacity of the organization, the service provider or providers that are able to provide the service. So service provider capacity is one of the things that is most important to know. The idea and need to scale is one thing, and the ability to scale is another. So making sure that there is the basis by which the service providers are supported to scale, both their management, their ability to grow and to meet the need, and then to have evaluated data that has the ability to be evaluated in the cost savings or cost avoidance, because there's really two things to look at on the cost side. One is what is cashable savings? Can you prove savings as direct cash savings, or do you prove them as avoidable costs? So if you did a lead poisoning prevention social impact bond, you're avoiding cost, for example. And then do you have the healthcare system or the health department or health systems that would be the beneficiaries, if you will, that would be able to be identified as the payer in doing that. We're happy to talk to people about if they're interested in doing social impact bonds, of the lessons that we've learned on that, but that's some of my thoughts.
Thank you. And I have a question for Gina. You might know the well building standard just released by Delos. Now I just realized, do you say Delos or Delos? Could you share your thoughts about the well building standard? Have you looked into it, and what do you think?
I know that, remember I'm a newbie at Healthy Building Network, so I do know that Healthy Building Network and our partners know it well, and we're leveraging and connecting with them, but I can't personally respond to that one yet, but it is one that we think is a really important standard to pay attention to and to integrate in all this work.
Fantastic. Thanks, Gina. Marianne, you did a fantastic convening that brought together a ton of different people. Can you share a little bit of the process of working with a committee and how you did that to bring together health, housing folks in Long Island? What were the challenges? What were the big successes from your perspective for the process of organizing a convening?
Well, one of the assets that we had was a board member who's the CEO of the Health and Welfare Council for Long Island, and so she was an expert in the field, and she was working with the healthcare providers on the community needs assessment, and so she had the contacts, and we worked with her to bring the health people together. And we had a meeting. We realized that the health people knew nothing about housing and the housing people knew nothing about health, and that we wanted to rectify that, and decided that the way to get that conversation started was to have a convening. And so we created a conference committee that brought together people from both sides. And I think that engagement is what enabled us to build that partnership and, quite frankly, to attract the resources that we needed to implement that as well as the pilot.
Thank you. And we had intended to have a slightly longer Q&A session, but Kimberly tells me we can do one more question, and then we're going to go to resources, things that folks can use today, later. What about sharing a little bit more about data? Carla, could you share a little bit more about data? The person who wrote in, data. Please share your experience in collecting data for bringing this issue and share outcomes that we can learn from. So you shared a little bit on your presentation, but could you care to share a little bit more?
We can. Data is always the hardest thing to get. We're working with one of the larger universities in St. Louis to try to do an evaluation for us. So we have anecdotal data. We have 90% of the small pilot that we did have not had a repeat admission to the emergency room or to the hospital, which is pretty phenomenal. So we're still working on that. We think that we need more data, but we've convinced the hospital that the program works. So I think it's a constant trying to get the data, trying to get it into a readable format for the hospitals. And so we're still working on it, but we have some data.
Can I add to that real quick?
Absolutely.
So in the real vetting of data, as we've looked at Pay for Success and trying to build the case for Medicaid payment models for healthy housing, and in making the case of the tremendous benefits out of energy efficiency, it's really critical that you ask the key questions. It's not the amount of data, it's the quality of the questions, of getting to what is the outcome you're trying to prove, and really keeping focused on data. We find that a lot of people fail on their data collection because they try to ask too many questions, and therefore they get bogged down in data pollution instead of being able to focus on the point. So I think really clarity and simplicity of data. The other thing is to remember data is cheaper and cheaper to aggregate and to find, but really important in making the case.
Thank you. And now I'm going to turn this over to Kimberly, who's going to share a few resources.
Thank you, Sarah. So right now I'm just going to go ahead and share a couple of tools and resources before we end the webinar today. The first one is the Enterprise Green Communities Criteria. This is the leading U.S. standard for design, construction, and operation of healthy, energy efficient, and environmentally responsible affordable housing. And for the first time, they expanded their emphasis on residents' health through the Healthy Living Environment category, and this includes best practices in active design, health impact assessments, and new standards for indoor air quality. If you want to check out the health data sources, they're all found on pages 25, 26, and 33. Also, you can check out the National Center for Healthy Housing and their resources. They have a Healthy Homes Clearinghouse that provides online information such as publications from federal agencies, peer-reviewed journals, and other sources on healthy homes topics. And they also provide an overview of key financing strategies and examples of home-based lead and asthma programs that are currently being financed by health partners, as well as additional links to resources to explore options for healthcare financing of other Healthy Homes initiatives. The third resource, like Ruthann mentioned earlier, the Green and Healthy Homes Initiative has the Ask the Experts feature, where leading experts in environmental health, family advocacy, energy efficiency, and pest control have provided answers to frequently asked questions. And they also provide, like Ruthann said, a Healthy Homes quiz where families can take a simple quiz to see if they have any home health hazards. And they also offer educational information on the 8 elements of healthy homes, as well as common home health hazards. And then lastly, we have the Centers for Disease Control and Prevention Healthy Homes website. They have a section specifically geared towards housing and public health professionals. The website provides links to healthy homes information and focuses on specific topic areas such as indoor air quality, drinking water safety, pest management, and healthy homes. And on this website, you can also find manuals for housing professionals on smoke-free policies in multi-unit housing, as well as healthy home inspection, integrated pest management, and much more. So right here is the contact information for everyone that was on the webinar today. If you guys have any questions, again, we want to thank everyone for bearing with us. I know there was a lot of static on the line today, but I hope you guys still found this webinar to be very useful. And the next webinar will be on healthy people and how we can improve the health of people throughout the lifespan. And that will take place on November 3rd from 2 to 3 p.m. And we'll open up the registration in the next 2 weeks. And at the end of the webinar, you may also notice that we have a brief survey that should take you no longer than 5 minutes to help us better deliver webinars in the future. So thank you so much for your time today, and I hope you guys have a great rest of your Tuesday.
Thank you, Kimberly. One last thing, if you want to see these presentations, these amazing things that folks are doing, they are already on the website. So thank you again, and have a great day.